In this video, I thought I'd go through how to get the most out of your rotation in anesthesia. Now, for everyone's first rotation in anesthesia, it's often really short. So it's often just maybe 6 weeks, 3 months, 6 months if you're really lucky. And in that time, you need to learn so much information and get used to so many different consultants and their opinions and their practices, and try to learn as much as you can in a very short space of time. So I thought I'd go through some of the non-technical aspects of this process. So first of all, arranging your rotation. Number two, how do you retain facts and skills without information overload? For example, having better organization, using apps like Evernote, recipes, Anki cards, for example. Number three, getting the most out of your personal tutor, which, let's face it, is your consultant, which is amazing to think of that resource. Having that one-on-one contact with a consultant. In most other specialties, you probably wouldn't get that experience. And then going through number four, a whole bunch of resources that I'll give you access to and links to. So first of all, arranging your rotation. So there's quite a few points here. One of the big ones I tell all my students is to meet up with your supervisor. So make sure that you meet up with them at the start of your rotation, at least midway, and then at the end. And what you really want to do is, if you want to really get a good idea of how you're doing, whether there's something that's not quite working well, whether you've had any complaints, whether people are telling you that you're doing a really good job. But you need to get feedback for this, and the only way to do this is through regular meetings with your supervisor. One of the trainee doctors I had in the past, at the end of every list, would simply, very matter-of-factly, just ask their consultant, what did you think? How did this list go? Is there any advice you can give me, any feedback you can give me? And that really puts the onus on your supervisor to provide that constructive feedback. So at the end of your rotation, if the feedback is, let's say, negative, then there's no reason why that should be a surprise, and there's a lot of things that you could work on during that time. I really encourage everyone to have frequent feedback sessions with their supervisor, and even at the end of the day with their supervising consultant. Also, try to look for a small project. So this can be anything really. You just want to try to be a little bit more involved in the department than just turning up to work. Whether it's an audit, data collection, presenting at a journal club or an M&M, whatever it is, there's always a little project you can do. And there's a really good piece of advice for any rotation you do, whether it's anesthesia or surgical or medical, to just be part of a department to present. You probably won't be the person that knows the most about any topic, especially in that specialty, but it's just a learning process. You're at the very bottom of the ladder, and it's so important to get involved and start learning, making mistakes, and just putting in that extra effort. Now, anesthesia is one of those specialties where things are so unique from most of other medicine, and it's a time when because things are so different, and there's certain times when there's very little time for reflection and contemplation. For example, the anesthetic induction or emergence, so many things happen very quickly. And the only way to get better at things that happen in a very quick fashion, or things that are quite complex, is to just do it many, many times. And so I tell every student, really, if you can, request the high turnover lists. So this is hysteroscopy DNCs, lumps and bumps, cystoscopies, tonsillectomies, and these are often done at a smaller hospital. For example, at our hospital chain, for example, at our hospital chain in Western Health, it would be Williamstown or Joan Kern or even Sunshine, whereas Footscray Hospital would have quite large cases that, in one list, in one session, morning or afternoon, you may only have 1 or 2 cases. And that doesn't really facilitate you getting through the process and getting the airway practice that you probably want, constantly. These small lists, so often they'll have, 4, 5, sometimes even 6 or 7 patients on each list, which means that you simply get so much airway practice that you'll be very different to someone who only had 1 airway management case per list. You'll just get so much more practice and therefore be much better at what you're doing. I also encourage everyone to keep a logbook. This is a really good self-audit and reflection tool. All I did back in the day was keep a spreadsheet. Essentially, you just want to be able to identify roughly the patient's demographics without any identifying details, the size cannula did, if you did the airway management that you did, intubation, LMA or bag masking, and any salient points, what kind of surgery it was, were there any hiccups or any incidences, any learning points. And then just refresh that at the end of the day. You write it down, you type it into your Excel spreadsheet. And the great thing about this is that at the end of your rotation, your supervisor might say, how did everything go? And you can, matter of fact, without any discrepancy, say, yep, I did 200 cases, I did 50 intubations, I managed the airway, 200 times or whatever it is. And you can give your supervisor concrete answers, which I think is a really, really useful thing to be able to do. In fact, when I was first starting my training, in one of the first interviews I went for the anaesthetic job, I remember in my cover letter writing how many anaesthetics I'd done and logged. And in the interview, they said, look, you seem really experienced from the amount of cases you've done. You should be going for the job above. The fact that most cover letters are often just a lot of words about how good you would like to be or how good you think you are means that if you're able to put a point of difference, such as logging a really good number of cases, a good number of procedures, it shows with evidence your skill set and what you're capable of doing and your interest level. So I think keeping a logbook is an absolute must. I'd also say find out from the registrars and trainees before you who the best teachers are, find out what they enjoy teaching, and then try to align yourself up with those anaesthetists to try to get the best out of your rotation as well. Some hospitals, some rotations have inbuilt workplace-based assessments, and this often doesn't happen for the non-accredited trainees, such as if you're a junior anaesthetist, a training anaesthetist before you get onto the program. But you can always ask to do these things and ask your supervisor of training whether there's the ability to do workplace-based assessment. These include DOPS, which are demonstration of procedural skills, and CBDs, or case-based discussions, or mini CEXs. So what these are, essentially presenting or showing that you're able to do something and getting really solid feedback that's recorded. Again, a really great way to show that you're interested and a great way of getting solid feedback from your supervisor. And no matter how bad or good the feedback is, it doesn't matter, you're just there to improve. So how to retain info. So everyone who's watching this video has probably done enough exams. And if you're a doctor of any level, you've done so many exams, and you've probably done really well. But whether you're junior or senior, you'll be less confident at the things you are new to or do infrequently. And so that's what it's really important that, number one, you have repetition and immersion. Again, I'll send a link to a document about how I perceive studying anesthesia and studying for our anesthetic exams. I often use apps such as Evernote. This is a fantastic way of tagging and organizing all your notes, papers, any interesting recipes. So pretty much every learning point recipe that a consultant has shown you for how to do something, whether it's how they intubate, how they do regional anesthesia, how they set up an infusion driver, whatever it is, you can log that into your file, into a card or Evernote, and then access it at a moment's notice. Again, I'm a really big fan of immersive learning. So this rotation is very difficult to get. It's a very sought after rotation in anesthesia. And so in that time, you want to get the most out of that time. So what I'd encourage you to do is read as much about anesthesia, write about anesthesia, listen to as many podcasts as you can, listen to lectures online, do some simulation training beforehand, during, and there's plenty of hospitals that run that. Try to teach something, try to present at the meeting, but you want to just live and breathe everything about anesthesia during this rotation so you can make it as interesting for you as possible. And finally, join groups. So I run an ABCs of Anesthesia Facebook group, and just have a discussion online there. See what their opinions are about interesting concepts, and that's a really great way of even starting a discussion with your consultant or your trainer or your colleagues when you're in theatre. Okay, so how do you get the most out of your personal tutor? So one of the biggest things is it's so important to see the patient or look up the notes at least the night before you go into theatre. And what this does is, that if you're junior, if anesthesia is unfamiliar, everything will take you a lot longer than it would a senior trainee. So, just being able to have a heads up about the patient, get your head around their issues is so important. So what I do the night before or the day before, find out who's on the patient list and just look them up on the electronic medical record or whatever it is. Otherwise, I usually get into hospital early and do the same thing. And if the patients are available, I'll be able to look and chat to the patients before my consultant and then present the case to them. Now, one of the other things I used to do for some cases, especially if they're very different, tricky cases, big cases, or if I wanted to do something a bit unique, I would email or call my consultant. And obviously use your judgment. Some consultants, some supervisors don't want to be called the day before, but email is fine. Others definitely want to be called. In my experience, I really like having a phone call from my trainee. It's always just a quick chat anyway, and if I'm too busy to answer, it's not a problem. And then you can always use language like, do you mind if I run the case by you? Tell them about the patient and tell them a plan. It's a really great way of showing that you're keen, showing that you're enthusiastic, and getting a head start on planning for the case the next day. I always have a learning objective, whether it's airway management, drugs, and the specific medications that we use, or any individual medication you might consider. Assessment of something, crisis management. Have an objective for each session of anesthesia or the day, and try to grill your consultant and get a session on that. It's always useful to have a bit of an opinion before you come with a question. So, for example, you could read a paper or ask opinion of someone else, even go online and just find out what's there, and say, I've read this was interesting, what's your opinion? I often ask the same question from different supervisors, different consultant anesthetists, because everyone has a different approach to something. It's really great to see where the logic and the reasoning for different approaches. Often target a consultant's interests. So, I heard you're very good at regional anesthesia or difficult airways or trauma. Do you mind if we discuss that? How did you improve your skills at this? How did you learn this? What are your thoughts on this? And again, as I mentioned before, always ask for feedback. Just say something as simple as, I just wanted to get some feedback from you about the day. Is there anything you think I could work on or improve? Such a simple statement, non-confrontational, and really shows that you really want to improve. And I'd tell every single trainee, especially in their junior years, even in their senior years, to definitely ask that question of each supervisor. A lot of trainees ask me this question: so how do I add value during my rotation? And this is a really tricky thing, because there's not so much that you can do as a junior trainee. There's very little scope for your practice, but there's a lot of things you can do. So depending on your level of training, you might consider upskilling in things like regional anesthesia. So regional anesthesia is obviously using ultrasound or otherwise to find specific nerves and then block them with local anesthetic. It's a reasonably specialized technique. Most anesthetists will have a vague idea of how to do it, but not every anesthetist knows how to do it. So if you are able to improve your skills in that, under supervision, I think it's a really great way of adding value. Likewise, learning transthoracic echocardiography, or TTE. Again, you can do a number of courses through University of Melbourne and other platforms where you can learn the skill. There's a lot of apps out there, and now ultrasound with the cardiac probe, the echo probe, are really commonplace. Learning that skill again can be invaluable in your clinical practice, and also show that you're really interested in learning more. I like to think that if you're able to add value in things that other people aren't good at, and statistics and epidemiology is one of those areas that a lot of times people just aren't good at, no matter how senior they are. So getting a diploma in stats of some sort can be a really, really great way of adding value. Again, something that people aren't really good at is infotech. So having IT skills, learning how to make websites, develop websites, apps, how do you even make a YouTube channel? These are all really interesting skills, and not many people will have those skills. One of the other really interesting things that I never thought about when I was going through my training is joining a hospital committee. So these committees are all throughout the hospital, and they really encourage junior doctor participation, especially over the last few years I've noticed that. So whether it's joining the deteriorating patient committee, medical education committee, a welfare interest group, even the Australian Medical Association or your local medical association, can be a way that you can contribute above and beyond what a normal trainee does. So I think it's a really useful way of getting involved if you're interested in any particular area. And the way you could find this is talk to the hospital management or the medical education office in your hospital, and they'll have lots of information about how you can contribute. One of my passions obviously is education, and I think it's a really great thing to do as much education as you can, obviously, whether it's on online platforms like Coursera or Udemy, or courses through your hospital outside. There's so many different things that you can learn outside of your standard medical education, and that can be so incredibly useful. But what I tell my trainees, it's the first level of interest is to do the course. So you pay money, you do a course, and you might get a certificate. But I feel like the next level of everything is to either run a course yourself, teach a course, or create something. So if you find something that you're really interested in and you've developed a bit of skill at, instead of just being an ALS accredited doctor, why not be an advanced life support instructor? And I tell every one of my trainees, when they do a course, see if they can add value, see if they can help in some way, whether they can be an instructor sometime into the future. I think it's a really great way, again, of adding value. So I'll have links in the show notes for a number of resources, but essentially this is all part of immersion. So websites, articles. Now I'm actually thinking of giving a link to a Dropbox folder where I usually share a lot of my documents, which is papers and articles and various things, information on various things. And that's another way of just immersing yourself in your rotation and in anesthesia. Good, so a quick summary. a lot of these are the non-technical aspects that will, vastly enhance your experience in that really short time frame that you have as a junior anesthetic trainee. So arranging your rotation, repetition, immersion, and retaining the facts in a very organized way using information technology apps like Evernote to do so. Getting the most out of your consultant, how to be enthusiastic, how to get the most out of that short time frame with your personal tutor, creating value with extra skills, and a number of resources. So thanks again. If you enjoyed this, please comment and subscribe. Thanks very much for watching.